Some new developments in the medical field, the breakthrough taking place over the weekend that is likely to impact many males locally who suffer from the side effects of diabetes. Antoinette Smith joins us live in the studio with the latest. Good morning again, Antoinette.
Thanks, LaDon. Well, according to the World Health Organization, about 150 million men worldwide suffer from erectile dysfunction. And a few weeks ago, our guest told you about an innovative procedure that's changing the lives of men who suffer from that impairment. So joining us live in studio once again is urologist Dr. Gregory Pinto. Thank you for joining us.
Thank you for having me.
So you have a little bit of good news for us. The procedure has been finally done locally. So can you update us about that and tell us how it's been?
Well, it's a state-of-the-art development in terms of the management of erectile dysfunction. So I've always had the message that you can always rise again, no matter what. There are tens of thousands of Bahamian men, unfortunately, that live in silence and in depression. They have a life that's devoid of happiness and poor self-esteem because they're not able to rise to the occasion. No matter what, if it's diabetes, if it's hypertension, if it's both, it's cardiovascular disease, so there's a strong correlation between erectile dysfunction and cardiovascular disease. So when you have erectile dysfunction, you have probably a 70% chance of having some element of heart disease in your lifetime. Even young men who have sickle cell disease, there are men in their late teens, early 20s, will never get an erection again because, unfortunately, of the plague of sickle cell disease. So we can always get you to rise again. So the device is self-contained. Your partner will not know that you have it. You can always rise to the occasion. This device also has the advantage that it can increase your girth and length by up to 25%. So you can go for many years and have no erection to basically having an erection as any time that you want, for as long as you want, and you'd be better and longer than you ever were before. So it changes the landscape considerably. So men who have given up hope, this is hope for them. And this is a joint effort with my cousin. So there are two Bahamian first cousins who are urologists. My cousin, Dr. Brian Davis Joseph, who's an assistant professor of urology at Columbia. He's joined Urology Care Bahamas. So we're here to not only for men with erectile dysfunction, so men, women, children, from premature babies to men and women in their 90s, we're going to provide state-of-the-art, world-class urological care right home in the Bahamas.
Your cousin was here with you recently,
yes,
where you guys performed that procedure. And
it's gone, and it went very well. So part of the procedure is you can determine that it's working intraoperatively and postoperatively, so it's working right away. So the men are ecstatic. Many of them have not had an erection in many, many years, and now they're in their full glory. So stop men living in silence. I'm here as part of Urology Care Bahamas that we can give you confidential, comprehensive, state-of-the-art care for any urological problem, but we're trying to emphasize we're creating a world-class center, and this also involves medical tourism for erectile dysfunction, and it's an epidemic throughout the world. About 50% of 50-year-olds, 60% of 60-year-olds, so it goes up as you get older. So every man is going to face some amount of erectile dysfunction in their lifetime because of many illnesses such as diabetes or hypertension or sickle cell or heart disease. It can affect them even at a younger age.
Right. Now, this is a outpatient procedure, meaning that you can come in and
so
do it.
It's anonymous. We use fake names. There's no paper trail. No one knows who you are. You come in, you get it done. There's minimal recovery. It's a minimally invasive procedure, and you're good to go.
How are your patients doing? What's the healing process like?
So there is minimal pain afterwards. You're actually cycling the device, so it's up and down as part of an exercise post-operatively, even from day one. But we want you to wait at least 4 weeks before actually partaking in the act.
So what is the wait list?
Oh, the numbers are increasing. So there's so many men in this country that didn't know that this was available to them. They have given up on ever having that part of their life. So these are many middle-aged men who have a partner that they've both are going through this. So erectile dysfunction is something that couples go through. So this gives them both hope. It gives them a new lease on life. So you can always rise again. You can always have that part of your life back again where you're going to enjoy a satisfying sexual life.
And in terms of medical tourism, how is that working out?
Very well. So even there, the waiting list is increasing day by day. So what I'd like to impart is that you don't have to go away to get first world-class care for urology or any field in medicine. Bahamas has it. And you can have your anonymity, you can always rise again. Please do not give up hope. We're also rolling out low-intensity sound wave therapy. So if the Viagra's, the Cialis do not work, and I'd also like to stress, you need to treat the root cause of erectile dysfunction. And that can be numerous. But if you're poorly controlled diabetic hypertension, or you have heart disease or atherosclerosis, we need to treat that because that can affect every other organ of your body as well.
Well, world-class treatment for problems with erectile dysfunction is here right in the Bahamas. For more, you can research with Dr. Gregory Pinto at the Urology Care Center. That's it for now. Back to you in the studio, LaDon.